What if one of your greatest superpowers, your brain, could be saved simply by knowing a few key things? Not magic, not luck, just awareness, timing, and action. Welcome to the story of stroke. Not as a distant medical term, but as a reality that affects millions of people, especially after age 50. And one where what you do today can literally save brain cells tomorrow. Stroke, the silent threat after 50. Why stroke awareness after 50 matters more. Stroke isn't just a disease of old age. It's a medical emergency that strikes suddenly and can change a life in minutes. Worldwide, stroke is one of the leading causes of disability and death, second only to heart disease in many countries. In Indonesia, for example, stroke accounts for 11.2% of total disability and 18.5% of total deaths. The prevalence of stroke there reached 8.3 per 1,000 people in 2023, and it remains one of the most costly conditions in healthcare spending. And while stroke can happen at any age, even younger adults are not immune. The risk increases significantly after 50, partly because of cumulative stress on blood vessels, years of blood pressure changes, and other metabolic factors that aging bodies face. 2. Why stroke should be on your radar after 50. The biggest danger of a stroke is this: every minute counts. Medical experts now speak about a golden window, ideally within 4.5 hours after the first symptom, when treatment is most effective and can dramatically reduce lasting brain damage. In the UK, data shows people often wait 88 minutes before making an emergency call, and that delay can cost millions of brain cells per minute. Stroke happens when a blood vessel to the brain becomes blocked, ischemic stroke, or a vessel ruptures and bleeds into the brain, hemorrhagic stroke. Both types injure brain tissue, leading to loss of function affecting movement, speech, vision, or cognition. 3. Know the signs. Fast saves lives. To make stroke awareness practical and memorable, health professionals use the acronym FAST. F. Face drooping. One side of the face looks uneven. A. Arm weakness. One arm drifts downward when raised. S. Speech difficulty. Slurred or strange speech. T. Time to call emergency services immediately. Just one of these signs calls for immediate action. Don't wait for all of them to appear. In Indonesia, there's an equally memorable phrase, segera ke harus, which stands for signs you should immediately go to the hospital, recognizing face asymmetry, sudden weakness, speech problems, numbness, vision issues, or sudden severe headache. 4. The majority of strokes are preventable. Here's a striking fact. Up to 90% of strokes can be prevented if key risk factors are managed well. That's not a fringe statistic. That's heartening news backed by public health research. How? By paying attention to what we can change. Keep your blood pressure in check. High blood pressure is the biggest modifiable risk factor. Simple monitoring and lifestyle adjustments matter more than you think. Move your body regularly. Regular physical activity, even 30 minutes a day, 5 days a week, can reduce stroke risk by up to 25%. Eat a balanced diet. A diet rich in fruits, vegetables, healthy fats, and low in processed food supports not only vascular health, but the brain itself. Manage blood sugar and cholesterol. Diabetes and high LDL cholesterol both significantly increase stroke risk, so screening is essential. Drop smoking and limit alcohol. Smoking damages blood vessels and dramatically raises stroke risk. Reducing or quitting saves lives. These steps may seem small, But when accumulated over months and years, they become powerful shields against stroke, especially after 50. 5. Emergency response. What to do right now. You are not powerless in the face of a stroke. What you do in the moment can save brain cells and a life. Recognize the symptoms, even if they come and go. Act fast. Call emergency services immediately. Stay calm but urgent. Every minute matters. Medical professionals emphasize that there is no harmless stroke symptom. Even brief or mild signs should be treated as emergencies. 6. Post-stroke recovery. Life after the event. Surviving the initial stroke is only the beginning for many people. Recovery often involves physical therapy to rebuild strength and coordination, speech therapy to improve communication and swallowing, lifestyle changes to prevent another stroke, emotional and psychological support, because recovery isn't just physical. Recovery is a long journey, often months or years, and families, caregivers, and social support play huge roles in long-term well-being. Rehabilitation programs are increasingly using interactive tools and personalized tracking to help patients stay motivated and measure progress, leading to better outcomes for movement and cognitive health. 7. Why awareness after 50 is a superpower. Let's be clear. Stroke isn't something that only happens elsewhere or to other people. It's real. It's partly preventable. It's urgent. And if you're over 50 or care about someone who is, your awareness is one of the strongest tools you have. This isn't fear-mongering, it's empowerment. Knowing what to watch for, how to act, and how to prevent means you're not just living longer, you're living stronger, smarter, and in control of your health narrative. 8. What you can do today. Learn FAST and SAGARA signs. Check your blood pressure regularly. Stay active, eat well, sleep enough. Keep regular health checkups. Talk openly with family and friends about stroke awareness. Because the brain is not just an organ, it's your story, your ideas, your laughter, your wisdom after 50. And the best way to protect that story? Stay aware, act fast, live well. Curious for more insights on beyond half-century living? Let's meet again on our other videos.